Good morning. I am Dr. Biswajyoti Guha. I am a senior consultant associated with Motherhood Hospital, Kolkata. Now, preeclampsia is a condition where the blood pressure is raised in pregnancy. Sometimes normotensive women, that is, women who is pregnant normally would have a blood pressure anywhere between 100 to 120 in the systolic and the diastolic of 80 millimeter of mercury. But sometimes what happens is the blood pressure gets raised in pregnancy, mainly in the second to third trimester, and it can range from 140/90 to quite high levels, and that is a condition where we should be very careful about, because preeclampsia may cause harm to the baby and may cause harm to the mother as well, and it's quite severe harm, and sometimes mother needs admission in ICU, and care has to be consulted with a clinical care specialist. So in preeclampsia, what we normally try to do is to pick the preeclampsia up quickly in the pregnancy. We try to control the blood sugar as much as possible with the medications we have, and if the blood pressure is not controlled, then we go for delivery, because we know that delivery is a treatment of preeclampsia. And sometimes if mothers have very high raised blood pressure, or they go into sometimes what we call eclamptic fit, like this kind of mothers may need to be admitted in ICU, and sometimes if the babies are born early, then they might need some care in the ICU, which we can provide. Both of them are quite easily provided here, so that should not be a problem. But the thing is to pick the preeclampsia quickly in pregnancy and treat it accordingly, and everything should be fine. Both mother and baby should be healthy and okay. So these are the two things that we really needed to discuss about in high-risk pregnancy. But there are certain other conditions also. Sometimes women normally would go into labor anywhere between 38 to 40 weeks, but sometimes women do go into labor very early in pregnancy, and we have to give medications to stop that labor, because we don't want to have a premature baby going into an ICU. And we try to diminish the cost of NICU admissions by trying to continue the pregnancy as much as possible. So, number one, the NICU cost is minimized, or NICU stay is diminished, and number two, if at all possible, we can avoid that NICU admission as well. So preterm labor is a condition where the lady may go into labor late second trimester, or in early third trimester, and that may be 32 to 34 weeks. And in these cases, what we try to do is mature the baby's lungs up, and if we tend to prolong the pregnancy as much as possible, and if it is not possible, at least the baby is in proper hands under the neonatal consultant. So this is what high-risk pregnancy is all about, and there are other features of high-risk pregnancy which we can discuss at a later date. Thank you very much.